You have to lay in the middle.
I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty and Indiana Wesleyan University. The video will be deleted by the student as soon as it is received and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hi.
Hello.
Hello. My name is Bernie, and I'm your nurse today. Are you Matthew Sanchez?
Yes.
Nice to meet you. How are you doing today,
I'm
Matthew?
doing pretty good.
You're doing great. It's a pretty cold day out there, isn't it?
Yep.
It's a little cooler here in South Texas. Now, can you tell me a little bit about, what brought you here today?
I have ear drainage and I'm wheezing a little bit.
Okay, so you're wheezing a little bit. And then tell me about your medications you take at home.
I take Vyvanse, albuterol, and Symbicort.
And Symbicort.
Yes.
Alrighty. And do you have any questions about taking your Symbicort and your albuterol?
What's the question again?
Do you have any questions about how to properly take your
Oh, no.
albuterol or your
No.
Okay, or your Symbicort. Okay. Because you remember that albuterol is a rescue inhaler.
Yes.
So it is going to rescue you when you're in an attack, an actual asthma attack. It's going to help with the wheezing. Yes, and Symbicort is more your prevention. So that's going to help prevent an asthma attack. So that's what you want to take regularly every day, as directed by your doctor.
Okay.
Okay. Alrighty. And do you have any allergies to any medications?
No.
No? Alrighty. And it says here that you're interested in, you would like to quit smoking. Is that correct?
Yeah.
Are you doing anything right now to help prevent?
Electric cigarette.
Okay, that's what that device is. Alrighty. Okay. And do you feel like that's working for you?
Yeah.
You do? Okay. And how long have you been using the electric cigarette?
For about a week now.
For about a week now. And you've noticed that you don't have that urge or craving?
I don't crave cigarettes anymore.
I don't feel like that you crave them anymore. Alrighty. Okay, well, I am going to start by doing a head-to-toe assessment. So I'm going to start with your head, and we're just going to go down the line and just make sure that your physical assessment is checking out okay. Now, I'm going to start by your head, and I'm just feeling to make sure that there's no lumps or any discomfort. You don't have any pain there, right?
Nope.
Nope. Do you feel me touch your cheeks?
Yes.
Alrighty. And which ear is draining?
All right.
Your right ear. Okay, let me take a look at that little right ear. I'm going to use my little light. Just going to kind of look, see if I can see the color of the drainage, because you said it's what color?
Yellow.
Yellow. Alrighty. Is there pain involved? No. Okay. You haven't been swimming?
No.
Okay. I know that the doctor will recommend you not swimming until, he comes in and does his assessment and figures out if you may have an ear infection. Okay, I need you to put your head over here a little bit more, okay? I'm checking your carotid artery, making sure that there's no problems there with the blood flow, and on this side too. Okay. No eye drainage?
No.
I saw on your questionnaire that you're taking Zyrtec for allergies. Is that helping you?
Yes.
Alrighty. And I'm just going to check your nose. Just want to make sure that, have you noticed any nose drainage?
Yes.
and then open wide for me. Say ah.
Ah.
Stick your tongue out. And can you like go back and forth with your tongue? Very good. Looks like you have braces. Been taking pretty good care of your braces, it looks like. Very good. And now I'm going to do a little assessment on your eyes. So if you look straight forward, you see my finger here? You see it moving in and out?
Yep.
Well.
Yeah.
Okay, now on the sides, tell me when you start to see my hands move.
No.
No? Okay, very good. Do you have any problems seeing colors? Any vision problems at all?
No.
No? Okay. Now, this assessment I'm going to do is called a neurological assessment, and I'm just checking to make sure that your nerves are intact, okay? So, look straight ahead for me. Straight ahead. Very good. Alrighty. And now I'm going to just feel your glands, feel your tonsils, make sure everything's good. I did notice a little bit of redness toward the back of your throat, but you do still have your tonsils and your adenoids, right?
Yeah.
You never had any surgeries like that?
No.
Okay. Alright, now what I'm going to do is I want to feel your down into your fifth, what we call your fifth intercostal space, where your heart, right around that location where your heart is, okay? I'm going to put my stethoscope on. I want to listen to your heart for a full minute, okay?
Okay.
Okay, so you just relax. Nice regular heartbeat. It's great. Now I'm going to feel your pulses. And we have pulses all throughout our body. And I'm just making sure that they're nice and strong pulses. And they are. Right there. And you also have pulses in your feet. Do you feel any coolness or numbness anywhere in your body?
No.
No? No cold spots?
No.
Alrighty, very good. Now, we're going to move on to your abdominal region, okay? Because what I'm going to do here is I'm going to just palpate. I'm going to feel your abdomen, see if you have any pain as I press. Any pain here?
No.
No pain here. Tell me a little bit about your diet. What kind of things do you eat?
Cheese, a lot of cheese,
Mm-hmm.
a lot of meat.
Mm-hmm.
If I can, a lot of salad.
Okay. Alrighty. You don't have any problems with constipation?
No.
How about diarrhea?
No.
Stomach upsets?
It's all normal.
All normal, no nausea, no vomiting. Alrighty. And so we just looked at your weight, and you're about 216 pounds roughly. Do you feel like that's an issue for you?
Well, I should learn how to lose weight. And yeah, a little bit.
Okay. So you would be open to learning about some strategies to help reduce your weight?
Yeah.
You would? Okay. How about with urinating? Any problems with urination?
No.
No? No burning? Okay. You feel like you're completely emptying your bladder? You drink lots of fluids?
Yep.
Okay. Alrighty. Now, as far as your arm strength, I'm going to see how, squeeze my fingers nice and snug. Very good. Alright, very good. And then to make sure, we're going to do, a musculoskeletal assessment. So I need you to do this with your other arm. See if you have any pain. Any discomfort when you go like this? Raise up high. No.
No.
No problems? No pain in your neck, shoulders?
Nope,
No.
nowhere.
Alrighty. Okay, now another thing I want to do is listen to your bowel sounds. I think that's a great plan for you to have in mind is weight reduction, because it looks like you have a family history of heart disease, and a lot of that can be prevented if you are if your weight is reduced. Okay, now let's do the same little assessment with your legs as far as up and down. This one, and then this one here. And can you bend your knees for me? Any pain when you bend your knees?
No.
No pain in that one. Okay, how about when you rotate your feet? You don't have any problems there?
Nope.
No? Alrighty. Okay, now, next part of the assessment is a very important part of the assessment, and that is the lungs. So we are going to listen to your lungs. So you can set up for me. Actually, you can turn around this way, so that way you'll be right here. There we go. Okay, now. I need you to take a deep breath from in and out. In and out. In and out. And can you scoot up just a little bit more, Matthew? Okay, very good. I'm going to listen to your lungs in the back here. In and out. Deep breath. Deep breath. In. Alrighty, now what I'm going to do is make sure that your spine is nice and intact here. There we go. No pain when I press your spine?
Nope.
Okay, very good. Alrighty, so now I'd like for you to stand up right here and turn around this way. And look me straight in the eye, and I want you to walk as you normally would walk at home. Okay, one more time. Okay. And the reason why we ask you to do that, Matthew, is because we're actually making sure that you are walking okay without any problems, pain, or you're not limping at all, so that's really great.
Oh yeah, okay.
Do you have any questions or concerns that you want me to relay to the doctor? No?
No.
Okay, alrighty then. Well, we're going to develop a plan of care. We're going to talk about some of the strategies that we can do to help you have a better life in general for the future. So congratulations on your decision to quit smoking. That's awesome. But we're also going to talk about ways we can help you to reduce your weight, okay?
Okay.
Okay, thank you so much. I'll see you later.
Bye.
Bye.
Have a nice weekend.
You too.